Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now,
On Capitol Hill, a routine oversight hearing erupted into one of the most emotionally charged confrontations over vaccines and public trust we have seen in years. If you want clear, fact-based reporting that explains not just what happened, but why it matters, take a moment to subscribe to this channel.
The chair now recognizes the gentlelady from Washington State, Dr. Schrier, for 5 minutes of questioning.
Secretary Kennedy, on May 27th, you posted a 60-second video on your X account unilaterally changing vaccine recommendations without consulting the customary panel of experts. As a pediatrician, I find that extremely alarming. So I thought we would talk a little bit about some vaccine-preventable diseases. Secretary Kennedy, and these are yes or no questions, have you ever treated measles?
Do I what?
Have you ever treated measles?
No.
Well, I have. Let me tell you how miserable it is. These kids have high fevers, struggling to breathe, and they are crying, they suffer. Great news is that there is a vaccine to prevent it. Secretary Kennedy, again, a yes or no question. Have you ever treated bacterial meningitis?
No.
Well, I have. These babies are so sick. They come into the ER with high fevers, they are floppy, and we have to figure out why. Do you know how we figure out if a baby has meningitis?
Excuse me?
Do you know how we figure out if a baby has spinal meningitis?
How many babies?
I'm going to explain how we figure out and determine if a baby has meningitis.
Okay.
We insert a needle between vertebrae until the fluid that surrounds the spinal cord drips out into a test tube. It's called a spinal tap. We used to do lots of them. Fortunately, we don't have to do very many of these anymore because we have 3 vaccines that prevent childhood meningitis. These are miracles. Secretary Kennedy, yes or no, have you ever treated pertussis or whooping cough?
No, I've had it.
Well, I have. And in infants, in fact, the one I treated, weeks old, came in because the baby just stopped breathing and turned blue. Let me tell you how scared those parents were. And I've treated a bunch of older kids with it. They cough so hard, they vomit. They run out of air. They break ribs. And if you don't catch it before 2 weeks, antibiotics don't even work. They cough for months with broken ribs, and that is why it is called a 100-day cough. But you know what's great? There's a vaccine that prevents this. Of course, here's the thing. Vaccines only work if you actually give them. And we know your record on this. We rely on the Advisory Committee on Immunization Practices, a panel of experts to recommend which vaccines people should get at which ages and the like. Now, I know Senator Cassidy had concerns about your views on this, and so when he voted to confirm you as Secretary of HHS on February 4th, he explained that decision by saying on the Senate floor that, quote, if confirmed, you will maintain the CDC's Advisory Committee on Immunization Practices without changes. But then 2 weeks ago, you fired all 17 experts on that very committee. Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now, we believe Senator Cassidy more than we trust you when it comes to vaccinations. It sounds to me like you gave him the answer he needed to hear in order to get his confirmation vote, and then as soon as you were secretary, you turned around and did whatever you want. You fired all 17 members.
I'm complying with all the agreements that I made with
Secretary,
Senator Cassidy.
You're now on the record. You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet. I yield back.
The gentlelady yields.
Representative Kim Schrier of Washington State, a practicing pediatrician, used her 5 minutes not just to question Health and Human Services Secretary Robert F. Kennedy Jr., but to put the lived reality of vaccine-preventable disease on the congressional record. What unfolded was less a political exchange and more a clinical indictment, grounded in experience, medicine, and the consequences of policy decisions made far from emergency rooms. Schrier began by referencing a video Secretary Kennedy posted announcing changes to vaccine recommendations without consulting the CDC's Advisory Committee on Immunization Practices, a long-standing panel of independent medical and scientific experts. For doctors, parents, and public health officials, that committee is not a formality. It is the backbone of how vaccine guidance is vetted, debated, and ultimately trusted. Then Schrier shifted tactics. Instead of arguing theory, she asked a series of yes or no questions rooted in frontline medicine. Had Kennedy ever treated measles? Had he ever treated bacterial meningitis? Had he ever treated whooping cough? Each answer was no. Schrier's response was not abstract. She described children burning with fever, struggling to breathe, crying in pain. She talked about floppy infants rushed into emergency rooms where doctors must decide within minutes whether to perform spinal taps, a needle inserted between vertebrae to collect cerebrospinal fluid, to determine if a baby has meningitis. She reminded the room that physicians used to perform those procedures routinely, and that they are now far rarer because vaccines prevent those infections in the first place. She then turned to pertussis, whooping cough, a disease often underestimated by people who have never seen it. Schrier described infants who stop breathing and turn blue, older children who cough so violently they vomit, fracture ribs, and gasp for air for months. Antibiotics, she noted, only help if the disease is caught early. Otherwise, children suffer through what is known as the 100-day cough. Her point was not rhetorical, it was foundational. Vaccines are not abstract policy tools. They are interventions that spare children pain, invasive procedures, permanent injury, and death. And they only work if they are actually given. Schrier asked the question plainly. Did Secretary Kennedy lie to Senator Cassidy? Kennedy denied making that agreement and suggested that Cassidy's statement was inaccurate. Schrier pushed back, pointing out that Cassidy made his remarks on the Senate floor, on the record, to the American people. The implication was unavoidable. Either the senator misled his colleagues or the secretary misled the senator. As Schrier's time ran out, she delivered a closing statement that underscored how deeply personal this issue is for many in the medical community. She said she trusted Senator Cassidy more than Secretary Kennedy on vaccines, accused Kennedy of saying what was necessary to secure confirmation, and warned that she would place responsibility for future deaths from vaccine-preventable illnesses squarely on his shoulders. This exchange matters far beyond the hearing room. Advisory panels, like ACIP, exist to insulate public health decisions from politics, ideology, and individual belief. When those panels are dismantled or bypassed, it raises questions not just about policy outcomes, but about credibility, transparency, and whether parents can trust the guidance they receive. Subscribe to this channel if you want continued, clear-eyed coverage of how these decisions are made and what they mean for families, doctors, and public health. At its core, this confrontation was about trust. Trust between lawmakers and executive officials, trust between parents and public health institutions, and trust between lived medical experience and political power. The broader lesson is this: public health is not theoretical. It is practiced one patient at a time, often in moments of fear and urgency. Decisions made in Washington ripple outward into emergency rooms, pediatric wards, and family homes. When expertise is sidelined, those ripples can turn into waves. We will continue following this story as it develops, including what replaces the fired advisory committee, how vaccine recommendations will be set going forward, and how lawmakers respond. Subscribe so you stay informed, grounded, and equipped to understand what is at stake, not just in politics, but in everyday life.